More than 6% of the New Zealand population and Australian population have diabetes. Vast majority, so 86% type 2. Rates in males are slightly higher than in females. And the prevalence of diabetes in Australia has doubled in the last 20 years. So this disease is something which is becoming more of a problem. It is a health priority area in both Australia and New Zealand due to its prevalence, range of chronic health complications. So this is the biggest problem, chronic health complications. Diabetes leads to a lot of complications over years. Contribution to mortality and of course cost to the healthcare system. How do you diagnose diabetes? Generally, 2 abnormal test results that demonstrate hyperglycemia are required to make the diagnosis. Either 2 fasting blood glucose levels equal to or more than 7 millimoles per liter, or 2 random venous blood glucose samples of more than 11.1 millimoles per liter. Okay. Diagnosis can also be made with just 1 abnormal reading if symptoms of hyperglycemia are present. What are those symptoms? Remember the classic triad? Polyuria, polydipsia, polyphagia. So if those symptoms are present, and if you get 1 abnormal reading, that's enough to make the diagnosis. Otherwise, you need 2 readings. Okay. And a plasma fasting blood glucose level of 6.1 indicates diabetes is unlikely. But now, between 6.1 and 7, what is that? Pre-diabetes. So you are in the danger zone now. Okay, pre-diabetes, and I'll talk about that a bit later. Okay. So diabetes can also be indicated by the presence of glucose in the urine, but this should be confirmed using blood tests. Because glucose in urine can appear also in certain kidney diseases. If renal threshold is low, with normal blood glucose levels, glucose can appear in the urine. Another test which was used quite frequently in the past, not so much now, but still used in some instances, is called OGTT, oral glucose tolerance test. So what you do, you ask patient to fast overnight, come to the clinic, you give them a glucose drink of 75 grams of glucose. You take 1 sample before giving the glucose, and then you take a sample 2 hours later. Okay? Or you can actually take regular samples 1 hour, 2 hour, 3 hour, because you want to see how the glucose goes up and how it comes down. If the person does not have diabetes, the blood glucose level will rise, and then it should come to below 7.8 millimoles per liter after 2 hours. In a person with diabetes, the fasting blood glucose is raised, and after 2 hours, it will be over 11.1 millimoles per liter. So that's clear. Okay. This is how it will look. So in a normal person, the fasting, say for example, is somewhere below is 5.5 or something. It'll go up, and then after 2 hours, it is already below the baseline. Yeah. In diabetic, it was higher to begin with. The fasting level is higher. When you give oral glucose challenge, the glucose level shoots up, and after 2 hours, it is still above 11.1. See here? It may come down gradually, but after 2 hours, it is quite high. What is pre-diabetes? It is a condition in which glucose homeostasis is between the normal level of control and that seen with diabetes. So that's the window between 6.1 and 7. It includes impaired fasting glucose and impaired glucose tolerance. So this is an important term to remember, impaired glucose tolerance. So in impaired fasting glucose, the fasting blood glucose level is raised, but the response to oral glucose tolerance test appears normal. The second one is impaired glucose tolerance. The fasting blood glucose level is normal, but when you challenge them with oral glucose, they have a hyperglycemic response, which is not as you see in diabetics, but it is not as you see in normal people, so somewhere in between. Okay, so this is known as pre-diabetes. Now, this should be considered as a warning that type 2 diabetes is developing and modifiable lifestyle factors should be changed. Pathophysiology of type 2. Type 1, we saw the problem was destruction of beta cells, right? Type 2, there are usually two issues at play. So there is a relative shortage of insulin. Relative shortage. It's not absence of insulin. With an ineffective response to insulin at the target cells, known as insulin resistance. The combination of slightly low insulin levels plus insulin resistance at the target cells. Yep. In most cases, the insulin secretion by the pancreas is initially increased. So when there is resistance, beta cells will try to produce more insulin to overcome the resistance. Okay? So there will be hyperinsulinemia in the initial stages of type 2 to compensate for the insulin resistance in peripheral tissues. As time passes, this excessive production of insulin leads to fatigue of the beta cells, and that can reach the point where these cells become unable to produce insulin. So in longer term, insulin production by the pancreas is almost completely diminished as these pancreatic beta cells undergo apoptosis. Now, obesity and type 2 diabetes mellitus, they are very close friends. So the most powerful risk factor for type 2 diabetes is obesity, especially central obesity or abdominal obesity. The risk of developing type 2 diabetes increases 10 times with severe obesity. Over half of those who are obese will eventually develop diabetes. Okay, so they are very closely linked to each other. Excessive energy intake predisposes an individual to type 2 diabetes by contributing to obesity. In obese individuals, insulin is less able to facilitate the entry of glucose into the liver, skeletal muscles, and adipose tissue. So obesity is tied very closely to insulin resistance. And in these people, when they lose weight, the insulin resistance actually decreases. So insulin can actually act on the target cells. Australia is becoming a leading country in rates of obesity, with 25% of adults and 10% of children being obese. A number of risk factors are common to obesity and diabetes, such as an unhealthy diet, physical inactivity, smoking, and dyslipidemia. So it therefore comes as no surprise to learn that obesity and diabetes often develop together. Yeah. Diabesity is a term used sometimes to describe diabetes occurring in the context of obesity, and it presents a substantial economic burden on the health system. Modifying risk factors associated with either diabetes or obesity will usually improve the other condition too. So, yeah, this is important to keep in mind. Now, things like pre-diabetes, metabolic syndrome, unhealthy diet, some genetic predisposition, family history, and tobacco smoking. So all these come together to cause type 2 diabetes. So you have to manage all these. Now, monitoring blood glucose control. Glucometer is a simple instrument which is available nowadays. And people with diabetes often use this glucometer to check their own blood levels. Common times for monitoring is either prior to meals or 2 hours after eating. So a pinprick, a drop of blood is usually enough to measure the blood glucose levels, right? So you have usually a strip where you put a drop of blood, insert the strip into glucometer, and it gives you the reading on the screen. Yeah. So what is the cutoff for diabetes? If it is a fasting sample, 7, yeah. And what is the random? 11.1. Yeah. Okay. HbA1c, I already told you what HbA1c is. It's a measure of glycemic control over a period of 120 days, roughly. Yeah. So the usual value is about 7%. Thank you.